Do you get a say in what kind of implants you get? Plastic surgeon Dr. Max Polo says you definitely do, but you also get lots of guidance from your doctor. How do you determine the size of the implant, especially if there's no skin maybe to add that implant, or
right.
That's what that's what makes
right.
you a surgeon.
Yes, yeah, great question, and that's something that we have improved over the years with our techniques.
Right.
Is being more careful about our planning and taking measurements of patients. I mean, it's important. There was a question in our script here about, can a woman have any cup size that they want? Not necessarily. At least within safe parameters. So, using an implant that matches the dimensions of a patient's anatomy is important. We always take measurements of the width of the breast, the height of the breast, and we want to use an implant that is appropriate to match that, so that the patients have a natural appearance, and also, to limit risks such as nerve injury and loss of sensation to the nipple, for example.
Right.
Placing too large of an implant can increase that risk.
I like that you brought that up, because I think part of that conversation with a surgeon is the realistic expectations.
Right.
And I know that this is a conversation, patients always come in with pictures and they say, "This is what I want." And that's where you come in and say, okay, I know that you want this, but this is what's going to work best.
Right.
So is that part of the conversation when someone comes in for a consult, or
Sure,
as they get ready for an operation?
Yes, it's a large part of it. And patients are more and more educated now. There's more and more information out there. And you sort of have to tailor that information to the patient's expectations. Some of it, they may have some misinformation.
Right.
They may misinterpret some information they have. So, it's important to first listen to the patient and understand what their goals are, and then, let them know if that's realistic, and let them know what you can realistically achieve, help them achieve.
Absolutely. Okay.
Yeah.
I know the viewers are excited. I know I'm excited. We're going to talk about implants and the different kind of implants on the market. Because to us, it might just look like a little ball of jelly, but there's so much science that goes to this.
There is.
What works to our body. Okay, so.
Yeah, and this science is, continuously being developed, and we're getting more and more options. And, similar to what we do with injectable products these days and facial fillers. The industry is, constantly working on giving us more tools for our toolbox, and that's what this represents. For specific indications, for specific patient needs, subtle changes and differences in the implants may help us achieve better results. Better results and fewer complications. So.
Apologies for interrupting, but do you decide which of the implants, or does a patient say, hey, I want saline, or I want silicone, or I think this is what's best?
Yeah. I mean, I offer the patients the options, and educate them as best I can. And then they make the decision in the end. I mean, if their decision, in my judgment, is a poor one, I'll try to convince them of what the better decision is as far as implant size and type and whatnot. But, part of the informed consent is, giving the patient all the options and letting them know what the relative risks and benefits of those options.
Okay, so let's go breast implants 101, the difference between saline, silicone, and that gummy bear implant as well.
Right. So there's basically saline and silicone implants, right?
Okay.
We've had standard saline implants. This is a sizer. This is a device we use in surgery to place in the implant pocket. It comes sterile, but it's meant to be discarded. And we just fill it to different volumes. This is what helps us really fine-tune what size implant we need. We may have a large asymmetry, and we're putting one size implant in one breast and another size in another breast.
Okay.
So to really fine tune and calculate exactly what volume we need in one breast to have it match, we'll put this in during surgery. We'll sit the operating room table up and judge where we have the best symmetry.
Right.
So we may fill this to within a range of 50 cc's or so, and when we get the best match, then we know what size implant we need, and then we'll open the implant at that point.
Okay.
But this is what a standard saline implant looks a lot like this without the tube attached. There's a tube that connects to the implant and then is removed and discarded, and there's just a valve and a patch.
That's so interesting.
So this is a standard saline in it. It's just a simple sac, silicone elastomer sac. So the outer shell of all the implants is made of silicone. It's silicone elastomer, which has different properties than silicone gel.
Okay.
But this is just a simple sac that contains the saline solution.
And this is really sturdy, obviously, and durable.
Right. Yes, it is. Yes. This is why they can last years.
Exactly.
These implants, there was a question about, are silicone implants better? One difference is that saline implants have to have a valve. This is another different type of saline implant, but this is a typical valve. This is how we fill the implant during surgery. It comes empty and deflated. We fill it during surgery. Once we have the final volume, we remove that fill tube and we cap the valve.
And there's no chance of this opening?
There is a chance of this opening or failing. Of course, it's a mechanical device. So this is one benefit of a silicone implant over a saline implant, is that this doesn't have that valve, which is an additional weak point on the implant. The silicone implants are filled through this patch on the back, and then this is sealed. So the saline implants also have this patch. It's necessary in the manufacturing process. This is another weak point in the shell that can fail and leak with time. So these are mechanical devices, just like any mechanical devices. With enough time and wear and tear, they're going to eventually break down and leak.
And these will sit differently in the breast as well?
Yes, exactly. So this is a standard saline implant. This is a standard silicone gel implant, which is, again, silicone elastomer on the outside and silicone gel on the inside. And this is a new implant. It's called the Ideal implant. It's a new type of saline implant that is more complex internally. It has multiple shells like this internally, which controls the movement of the saline inside. So basically, it's designed to make this implant feel more like a silicone implant. One of the benefits of silicone is it looks and feels more natural.
Like a
it
natural
moves
breast.
in the body more like tissue does than
and
saline.
This is trying to model
and
this a
is,
little bit.
Is exactly.